John, you were best buddies with Steve before I got to know him well, but I'm trying to figure out who knew him first.
Well, I mean, I did get a call from Steve many moons ago. Maybe 2015, something.
Okay. So 2015. Do you remember calling him, Steve? And we want to identify if that's the first time, because I think I got you beat if that's the first time you talked.
2015 would be my best recollection.
Why'd you call him, Steve? You remember?
I think it was the genesis of 988.
Oh, wow.
I'm like, maybe I should talk to the guy in charge of this before I try to start coming up with ways to improve it,
Yeah.
And my response was, "Oh, you're the crazy guy who wants to give it a 3-digit number. What is this?"
Actually, my best memory here, though, is John and I were at some conference. I don't remember what state it was in. And we were going out to eat with this group. And we had never had a Zoom meeting because that wasn't a thing yet. And we'd never met in person. It was all a virtual relationship via the phone. So I knew who he was, but he didn't know who I was. And so I played it out. Do you remember this, John?
I do, yeah.
So finally I blew my cover and,
Oh, you're Steve Eliason.
Yes.
Yeah. Or maybe I looked at your name tag and go, oh, no. So.
Well, we got a lot more history to plumb today. So let's get this show on the road, John.
Let's do it.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Welcome back to Lifelines, the 988 podcast with David and John. Season 2, we're deep into it. We're going to keep going into the vault and pulling back stories and history of the blueprints for a crisis system. But we're also going to look to the future and how we continue to build out the kind of care that really feels like care to the individual on their worst day. And Steve, I think you and I met earlier than 2015 because Doug Thomas, Kim Myers, they were such innovators working alongside you. And I came to Utah a couple of times related to Zero Suicide and Crisis Now. Did we meet then or was it later? Do you remember?
I think it was actually later, but we probably passed each other in the hall.
Yeah. So, John, we're so privileged to have Representative Steve Eliason join us today. Tell our audience, if they don't already know, about our amazing guest.
I'm happy to do it. David, our guest today is our good friend, Steve Eliason. He is a dad, a spouse, a CPA, and one of the top state representatives for behavioral health and suicide prevention in the United States. Steve was just reelected to his 8th consecutive term in the Utah House of Representatives, and for a very good reason. He's passed over 100 bills during his tenure in the legislature, most of which are bipartisan because they address issues that matter to everyone. He has passed dozens of bills related to suicide prevention, from funding Utah State Crisis Line to measures that enhance school mental health and gun safety, as well as laws designed to reduce drunk driving, homelessness, and many, many others. He's been consistently ranked as one of the top 5 most effective lawmakers in Utah. And for all of this, Steve has received national awards from Mental Health America and the American Foundation for Suicide Prevention. And there are many reasons to celebrate Steve today, David, but you and I came to know him as the first to propose a 3-digit number for the National Suicide Prevention Lifeline, later to be assigned the number 988. So it's with our highest praise and appreciation. I couldn't be more excited to welcome you to our program today, Representative Steve Eliason from Utah. Steve.
Oh, thank you. You're very, very kind. But as Helen Keller said, alone we can do so little, together we can do so much. This has all been a team effort, and deeply in gratitude to both of you for all the work you've done on transforming crisis services in our nation.
Oh, that's really great, Steve. Thank you so much. And I appreciate you saying it's a team effort. And John and I might make the case that 988 doesn't exist without you and Utah State Senator Dan Thatcher, that there's a lot of us who've been involved, but no one sort of saw it through from beginning. But we're going to get to that story. First, we want to learn a little bit more about you, and grew up in Utah, serving the South Salt Lake City County District. Tell us a little bit. This is an amazing city, John. It's a city where you see the beehive as the state symbol. You have to look harder than that, John. It's deep into the
bees.
It's the beehive emphasizes the early settlers' focus on industry and cooperation. So, Steve, let's learn a little bit about you. Steve, tell us your favorite skiing story. I don't know if that's Park City or Snowbird. What's your skiing story for us?
Wow, I've never been asked that, but I have one, and it's a lesson learned. So back last century, I was teaching skiing for the University of Utah, and I had the opportunity to ride up a ski lift at Alta with a man named Alf Ingen, who's considered the father of Utah skiing. Helped establish the first resort, immigrant from Norway, and he was in the line just right behind me, and there's nobody else there. And I thought, wow, I can ride up the chairlift with the father of Utah skiing. And I was so nervous. I was still a teenager, young adult. And I thought, I'll do it next chairlift. But there wasn't a next chairlift.
Oh,
and then
no.
walked away shortly thereafter. So it was a lesson learned that, to seize the opportunity. I still got to meet him. That was great. But you might have thought, that I would say, I ski down Corbett's Couloir, Jackson Hole or something like that. No, it was meeting a person that was so instrumental in the beginning of sport and industry in Utah.
Wow, that's a terrific story. All right, Steve, more about certainly skiing is a big thing in Utah, but also the Church of Latter-day Saints focused on the group of people who founded this state and Pioneers Day every year. Tell us your favorite. First, tell our audience what Pioneers Day is and what your favorite Pioneers Day story, Steve.
Yeah, so you've probably heard of Carl Malone, John Stockton, Carl Malone. They were the history of the Utah Jazz kind of. Well, when Carl Malone got picked up by Utah, he arrived and was staying in a hotel, and his birthday is July 24th, which happens to be Pioneer Day. And we have a gigantic parade, huge parade, and he was staying in a hotel right on the parade route, and he opened up his balcony, and he said, I thought they were holding a parade for me because I'd just been acquired by Utah. And then later, unfortunately, he learned that it was commemorating July 24th, 1847, when the Mormon pioneers pulled into the Dusty Valley and started Utah as we know it now. So,
or Steve, it's a both and.
Mm-hmm.
It was the parade for Pioneers Day and Carl Malone.
If we would have known what his legacy would have been, we would have created a float for him right then and there. Yes.
And Steve, you've told John and I before about getting your boys up, taking them to breakfast, seeing the floats and the parade, and reflecting on these important stories.
Yeah, I had relatives that came across the plains as pioneers, and so I wake the boys up early on Pioneer Day, and we go to a sunrise service and look at the parades and eat breakfast. So it's a fun tradition for me. I'm not sure what my kids think, but they get to go anyway.
And your favorite Winter Olympics story, Steve? So Park City and Salt Lake City were key for the 2002, and it's coming back.
Yep, 2034. So again, this is, you think it might be, I witnessed somebody set the long jump record or speed skating record, even though I went to both of those events and went to the opening ceremonies, and that was great. But we got tickets to the freestyle aerials. And a friend of ours was helping take care of two children whose mother was on hospice. And their mother passed away the day that we had tickets to this event. And to get the kids' minds off of that, they said, Steve, would you be willing to take them? And I had some extra tickets. So we took this young man and this young woman to this event up in Park City, and like to think that, maybe there was some healing through sport. And, so that was actually a really touching memory, even though it wasn't watching somebody set a record.
Yeah. Wow. Steve, have you ever joined any of the Sundance events?
Oh, yes, I have. We had a fabulous movie a few years ago called Bedlam. about the origins of, and the producer, who's also a psychiatrist, came out and we had a private screening with them and Q&A, and that was a remarkable event.
Let's talk more about that. We might want to summon that history with Crisis Jam. So
yeah, I'd like to see that too.
Yeah, me too, John. So let's put a pin in that and come back to it.
Yeah.
Steve, you invited John and I to come out as part of a huge stakeholder event with the Ad Council and the Huntsman Health Foundation, introduced us to amazing people like Christina Huntsman and David Huntsman. We got to visit the cancer treatment and research. Oh my God, I don't know what you call that.
Huntsman Cancer Institute.
Wow. And because of that, Steve, John and I were able to premiere our documentary film in the home of Christina Huntsman. None of that happens without you, Steve. So, wow, such great stuff coming out of Salt Lake City. And it was I loved working with Doug and Kim back when they were with the department. Such innovation coming out of Utah, Steve.
Well, thank you. We're just 1% of the nation's population, but we have a lot of dedicated, caring people. The Huntsman family, $150 million donation to mental health, the largest that we know of, to establish the Huntsman Mental Health Institute.
Yeah.
Fabulous things are starting to emerge from that donation. And a real, kind of like go back to the Beehive, a real collaborative spirit here of working together. It's, like in the world of mental health, it's not just bipartisan. This is nonpartisan. This is survival and thriving of our species. And almost all of the mental health bills I've passed, which are I think north of 60 now, almost always bipartisan, typically unanimous. And so in a time of so much division in our nation, and you look at, I know we're going to get to it, but 988, I think there was one no vote, out of over 500 people between the House and Senate that voted on. I mean, how do you get that kind of agreement on anything?
Yeah, that's incredible. I mean, Utah seems like a great place to be a servant leader, to be a leader that is in service of something. Because as you say, it's a beehive and everybody is looking to do something for the community. But what is that something? And Steve, you've done so much for the community. And I'm wondering, how does a guy who starts off with a CPA, I know you still got it and you're probably quite good at it, how do you become this kind of Mr. Smith Goes to Washington kind of guy, where you one day become a representative in the state of Utah, and then have this idea not just for Utah but for the nation? So how is it you got into suicide prevention too? Could you just tell us a little bit about that journey?
Yeah, so I served for many years on our state's largest homeless organization board called the Road Home, and my time was expiring there as board chair, and so I was like, well, what should I do next? So I kind of started asking questions around, like, what else can I do in the community? And there was some turnover in my House of Representatives area. And at intermission at a play, I asked somebody some questions, just, waiting in the line to buy refreshments. And a few days later, I get a call from somebody saying, hey, we hear you're thinking about running for the legislature. I'm like, fake news. Nope, not true. Have no idea where that even came from. Like, well, we think you should do it. Somehow they coerced me to file to run. And hours later, I'm down, swearing the oath of candidacy, pretty much clueless. I could write a book called The Accidental Politician. And then I somehow got elected, and I campaigned on low taxes and a balanced budget, things that a CPA would kind of focus on. And then several children died in my son's school from suicide. And I was a scoutmaster at the time, and there was a boy in my troop. His father was in prison at the time, and he said, Steve, there's kids dying in my school and nobody's talking about it. And I remember looking in his eyes. I can still see him in my mind. And I thought, you might be next, because I knew his difficult background. So I went to the principal and said, what are you going to do about this? And that really began the journey. I met that they decided to hold a parent night to teach parents about suicide prevention and things like that. And I met the father of one of these children who had passed away. And tearfully pled with me, please do something about this epidemic. Had no idea suicide was the leading cause of death for children in Utah. And so I just started calling every expert that I could think of and trying to immerse myself in this topic. And as I started working on it, so many of my colleagues came out of the woodwork at the legislature and would share their personal stories with me, their family stories, both sides of the aisle. That didn't matter. And then we really started picking up momentum.
Yeah.
And actually, one really quick story, my first bill, a bunch of people had their lights on to speak against it, and I was getting pummeled. And a member of our minority party pushed his button and stood up. He hardly ever speaks, but he'd been around a long time. And he said, I was working at the Capitol one day, and I got a call that I needed to come to the hospital because my son had just attempted suicide. And they said, you'd better hurry. And then he paused and he said, I didn't make it in time before he passed away.
Oh, my.
And our Speaker of the House later told this story to the media. She said, after he spoke, all of the lights turned off, and then my bill passed. And then we really started getting momentum as people were willing to share their stories about how this isn't a partisan issue. This is a human issue.
And this matters, Steve. This matters, and the work you've done is making a difference. We didn't have discussions of crisis systems of care and the stigma reduction that the Ad Council. So, John, let's jump further in with Steve. But first, let's talk about the sponsor that brings us this program. John, you and I work closely with the Crisis Jam, which is a learning community funded by SAMHSA and NASBID weekly meeting. But this podcast where you and I get to be with these amazing crisis leaders and stakeholders and lived experience voices comes to us from Behavioral Health Link and their crisis software platform. So tell us a little bit about that work, John, which is meant to support people supporting individuals who might be at risk.
It really is, David. And Steve, also, when he had this idea for 988, in order to just get those doors wide open for all people to easily access help when they were in suicidal crisis, he also knew that people needed someone to talk to, and they also needed somebody to respond. And there needed to be some kind of crisis care infrastructure behind that front door of 988. And all of that needed to be funded. But one thing that's really underpinning that infrastructure is something like the BHL platform, which helps connect the otherwise fragmented, siloed crisis care services across counties, regions, and states, providing an air traffic control-like capability to assure care continuity so no one in crisis gets lost. And BHL's modules are designed for supporting and coordinating care for 988 call centers. GPS-enabled mobile crisis dispatch is really important. Outpatient referral and scheduling, evidence-based follow-up support modules, and real-time tracking to find crisis beds for more immediate care placement where you need a bed right now. Now, BHL's modules can be integrated independently or altogether into your system to transform it to the Crisis Now model that it needs to be. So if you want to learn more about our state-of-the-art software, just check us out at behavioralhealthlink.com. David?
Steve, we got an outreach from a private equity firm who was looking at the 5 major products in this space. And John, it doesn't seem like that long ago that people were furiously putting maybe a note or two down with a pencil and paper and putting a clothespin on a binder to let them know that a mobile crisis team was out back before we had these electronic systems managing flow. But that private equity firm they said 60 customer interviews and believed that their conclusion was Behavioral Health Link's model, John, that you, Dr. Chuck, and others are building with Henry and Lily is one of the leaders in the field now. And it comes from these kinds of tools, John, of supporting people out in the space. We're going to get to the app that Steve and team have created, but we have an app for those mobile teams out there, a secure platform that allows us to follow them into the community and making sure they're safe as they do that work. So, Steve, we were in the middle of this story of how this began to be an important issue for you because of the lives that you were touched by. It got across the finish line with the legislature in Utah because of someone sharing their own story. But that went from those discussions, and again, you talked about a state with a small population, to impacting the whole country. How did that happen? And I think people will be surprised, Steve, that 988 comes from the work that you started in Utah. Tell how that connects.
Yeah. So, I think this is analogous to a lot of people's, journey through a mental health, crisis, in the sense that myself and Senator Dan Thatcher were working on getting a 3-digit number for Utah. And we tried for several years to no avail. And we failed. The big telecom companies even sent people out to try to kill our bill. And somebody recently shared, it's kind of like Michael Jordan tried out for his high school basketball team, and he didn't make the team. And then, later, obviously, we know the story, made the NBA and became maybe the greatest player of all time. Not really fair to compare ourselves to Michael Jordan, but in the sense of we tried and failed at the local level, state level, kind of like the high school. So we were naive enough to say, and it was at the advice of one of these telecom lobbyists, they said, this doesn't really work well on a state, just standalone basis, but nationally, it's a great idea. So I went back to Senator Thatcher and said, we need to stop and, just focusing on Utah. The nation needs this. So in 2017, I ran a resolution, HCR 25, calling on Congress to create a 3-digit number at the time from the N11 system. And that bill passed the House of Representatives back in 2017 unanimously. And our own Senator Orrin Hatch and Congressman Chris Stewart took our call to action seriously and ran the first bill to get FCC to start studying the issue and come up with a recommendation. And that's really how the journey began.
Steve,
but ultimately we succeeded.
Yeah, and I wouldn't apologize for the metaphor. 988 is the Air Jordan of the impact has been like nothing we've ever seen. John and I had a podcast a few weeks ago, and I asked ChatGPT to give me the top 10 innovations in mental health since the 50s, and deinstitutionalization. There was a host of things in that list you'd expect, and 988 was number 4. And wow. I asked AI, I said, you're going to have to look, I'm part of leading this 988, so appreciate it. But we just started, and it gave a full rationale for the potential and the sea change culturally that's already occurring as a result of 988. The number of which was not supposed to be 988. So, Steve, what did you expect the number to be as you and Dan Thatcher were thinking about a 3-digit number? And maybe that's part of the reason telecom was pushing back.
Yeah. So originally we thought 611 was our ticket to ride, because there's the N11 system, 911, 311, 211. Congress had set 8 numbers aside. You can't do 111, but and really the only last number was 611. And many years we found congressional testimony that said the FCC would allow telecom to use 611 temporarily until another national need was identified. And of course, they were using it for phone repair and phone sales. What we didn't know is that they were getting tens of millions of calls to 611.
Yeah.
And if they had to give that up, then they weren't going to get another N11 number, and it was going to maybe screw up their business model. But so it was kind of this fight against telecom. But fortunately, the FCC kind of threaded the needle and came up with an unused area code that's worked, frankly, much better, because we would have had calls probably for decades of people calling the National Lifeline, or actually calling their cell phone company and getting the National Lifeline.
That's right.
And that would have the thousands of hours that would have tied up of crisis workers explaining you called the wrong number, but anyway. So we ended up with 988, and besides, 611 doesn't rhyme with call 988 if you're not feeling great. Yeah. So here we are.
John, I was in your office, John, when that 611 number had come out in the day or two before. We were in New York City together. And initially, we wanted to be one of the, 8 or 9 most important numbers in the United States. I think Ajit Pai they were brilliant in that we're not one of the 8 most important numbers. We're one of the 2 most important. He wanted that 9 to symbolize emergency like 911. John, your reflection on it being 988 now, 2.5 years.
Yeah, I mean, again, even at the time, at first I was disappointed that 611 wasn't going to be the number, but I was also incredibly impressed with the out of the box thinking, the innovation, totally unprecedented to use. But they were so determined. Ajit Pai was so determined to do something for suicide prevention. Okay, we can't use 611. What can we use? Let's do something we've never done before. I'm going to pull this 3-digit number, this unused area code off the shelf out of the barn, and we're going to make that the conduit for all suicide prevention calls nationally in the United States. I thought that was just absolutely brilliant. And also it kind of opens the door for them to do that for other causes. So I thought that was really, really daring for them to do. But they said, nope, it's worth the risk. And thankfully, I think 988, as you say, it does rhyme with great, Steve. So I'm all for it.
Okay, so Steve, you referenced Karl Malone. Let's talk famous Utahns. You say it again?
Utahns.
So the most famous Utahn in entertainment, Steve, who is it?
Ooh, Donny Osmond.
Donnie Marie Osmond. Okay, what about the most important sports figure? AI says it's not Karl Malone. I was a little stunned. I didn't know this person came from Utah.
Ooh, John Stockton.
Steve Young is from Utah.
Yes, he was in BYU. He's quarterback at BYU.
I'm embarrassed. Now, I've got to tell you a quick story. Can I?
Please.
Yeah.
So when we wanted to start promoting, at the time, the Lifeline, before 988, myself and now our current governor, Spencer Cox, called Steve Young up. And we said, hey, we would really like your advocacy to do a PSA to help promote the National Lifeline. Because, we kind of really would like a male because, a lot of times men are more reticent to reach out and they know who you are. And he said, well, I just wrote a book about my struggles with mental health called Football, My Life Behind the Spiral.
Wow.
He says, not only do I want to do it, I want to pay for it.
Oh, my goodness.
And it turned into a PSA. I can send you the link to it.
It's great. I've seen it. You sent it way back.
It was the old 1-800 number, but it was phenomenal. And his commitment to this. So not only was he a Super Bowl MVP, more importantly to me, he's a mental health MVP.
Yes.
So that balances out a little bit. So first of all, 2 things. Karen Jones, we got 2 Crisis Jam follow-ups, Steve Young PSA and Bedlam. And number 2, that almost makes him a good human being because I was a kid, Steve, when I got the Sports Illustrated with the catch. Do you remember the catch when they upended Dallas in the NFC Championship, which they did over and over again? It's been a rough haul as a Cowboys fan, but we won't get sidelined on that. All right, the most famous Utahn in music.
Ooh.
Well, that would have been Donny Osmond, too.
I'm going to go back with my default there, Donnie Marie.
Yeah, I think that Dave Archuleta from American Idol runner-up. And political figures. Now, we should mention, obviously, John referenced Brigham Young, played a key role in the settlement of Utah as historical figure, but political figures, and we've mentioned several, Steve, but most famous, most important political figure from Utah.
Well, I'm going to probably get this wrong too. But at this juncture, because he really helped champion the bill for 988, and for so many other reasons, would be the late Senator Orrin Hatch.
Yeah. So AI said Mitt Romney, John Huntsman Jr., and Larry Miller, businessman and philanthropist who owned the Utah Jazz and contributed significantly to Utah's economy.
All great people.
Yeah,
absolutely.
Great, for sure.
Yeah.
10 years into 988, John Draper, we may see this list modify. And when we get to our most important last question, Steve, that may be the seeds, John, for this list changing in the future. But we'll get to that as we go. So it's time for the good news. Steve, we have a segment. We try to get into what's happening in crisis. And neither one of you guys were on the Crisis Jam yesterday, our learning community, but we had this trivia question. And first of all, kudos to SAMHSA, John Palmieri, Jill Mays, Belina Shaw, both CMHS and the 988 and Behavioral Health Crisis Coordinating Office. Got across the finish line, a massive effort with a huge number of stakeholders in the National Guidelines for Behavioral Health Coordinated Crisis System and Model Behavioral Health Crisis Services definitions, which were published. They also put a toolkit for mobile crisis out for public comment. But our question was, which of the following crisis policy documents came first? The Beyond Beds, that was the first version of National Guidelines for SAMHSA. The Crisis Monograph from John O'Brien and Kevin Martone's TAC. Crisis Now, which Mike Hogan and I were involved with. John, you were part of that effort with the Action Alliance. Or it was a green covered document called Crisis Services Effectiveness from SAMHSA. John Draper, do you remember all of these? Can you put them in order?
I do. Well, I'm going to say that Crisis Monograph is the first.
Yeah.
Absolutely. I don't remember what the date was Crisis Services Effectiveness came out, but I know Beyond Beds began before Crisis Now.
Well, Beyond Beds actually started those series of papers. If you just follow the timeline, first of all, the Crisis Monograph came out in 2005. John Draper, it's been 20 years. And really? I was going through that document this morning, and John, you and I had this conversation, but I would have humbly given myself credit for the air traffic control metaphor. And this morning, I'm like, oh my God, they were using that as a key part of that report 5 years before we were using it. And we got it from them. We read that report, carried it around like the New Testament under our arms. So amazing document.
Yeah, Beyond Beds, National Guidelines came out in 2020, but Beyond Beds started well before that, didn't it?
So the pathway here, John, is that SAMHSA document, and it had a green cover. It was a lot about the service definitions and the effectiveness of them. That came out in 2014. 2 years later, you and I were involved with Mike Hogan and a host of there were probably 40 of us. Becky Stoll was in that group, Margie Balfour, others. Developing the Crisis Now policy paper. And the following year, Brian Hepburn called me up and said, I want to see a business case in New Orleans at the National Dialogues Conference on Crisis Now. And I said, it'd be great if there was a business case, but I don't have one. And he said, well, you've got 6 weeks to put it together. And he was really right then ramping up what has been a 7-year focus from the state mental health leaders. And John, that was the first year they did that Beyond Beds series. So I think they have about 70 papers now.
Well, that's what made me think, my God, 70 papers?
70 papers started in 2017.
And only 7 years.
And then 2020 was the convergence of Beyond Beds and the national guidelines that came under that Eleanor McCants Katz administration came out. We talked to Kevin Martone, and he said this: the 2005 TAC Crisis Monograph was important in two ways. One, it provided a framework, one that holds true today for systems across the country to fill the void where crisis systems didn't exist. And two, it recognized there were pioneers doing the core components of crisis systems over 20 years ago. I'm proud that TAC has been a part of this this national transformation.
And David, that was the first time I saw the term air traffic control was in that.
I believe and again, we'll have to go back and ask John O'Brien if they borrowed that from yet someone else. But that report was using the 3 core components, and it was ahead of its time, talking about systems of care, and really laid the groundwork for all this amazing work that's been done. That got picked up and moved forward as we've gone along. So, though, gosh, Steve talked about all of this legislative work he's done and bills that he's been a part of and initiated. John, it's been more than suicide prevention and crisis. Has been in a lot of different spectrums.
Well, he has, but you've done. I mean, look, my near and dear to my heart is the work that you've been doing in suicide prevention in schools with young people. I mean, Steve, as you were saying, from beginning with the suicide in that community, that really sparked your sense of mission to do something for your community. That has never gone away. In fact, it's turned into a fire. But it's been a huge boon to schools in Utah. And if you could talk a little bit about maybe one or two of your favorite pieces of legislation that I know they're all kind of near and dear to you, but is there one or two that you're particularly that you love to talk about in terms of the work that you've been doing to prevent suicides and promote mental health in schools?
Yeah, there's two. I'll be brief. The first one is really along the lines of crisis services. After the Columbine shooting tragedy, a number of states created a crisis number, a tip number that kids could send tips in if they knew something. So we decided to create an app in Utah. It's called Safe UT. Did it through legislation where students could anonymously and confidentially submit a school safety tip. Well, me and again Senator Dan Thatcher thought, well, let's try to add in the ability for a student to talk to a licensed clinical social worker 24/7, 365 in case they're having a mental health issue of their own. And we just did that as an experiment, really. We didn't think much would happen with it. I said, well, let's tie it in with our crisis center, our Lifeline center at the time, because they're always there. And it blew up. And it was voluntary for every school in the state of Utah to do it. Now, every high school, every middle school, every charter school, basically, almost every elementary school, all of our schools, a system of higher education, have Safe UT. And in the past year, we had over 1 million back and forth chats between students, parents, teachers, and crisis workers. Knock on wood, Utah has never had a school shooting. We've averted a lot of them.
Wow.
But since 2019, our youth and young adult suicide rate, so this is 0 to 24, is down over 25%. And you can see the national numbers going up and ours are going down. And people say, why is that? I'm like, well, that's really complex. We don't have one specific answer. But over that same time frame, we see the volume of Safe UT and the utilization picking up. So that's the first bill. And eventually we hope that we can share this with the nation because it's a system of care. It's not just about an app.
Yeah.
Second is knowing that the vast majority of mental illnesses emerge during the young adult and teenage years, and that there's an average of 10 years between first symptoms and diagnosis and treatment nationally. I got thinking, we screen for vision, we screen for hearing, some schools screen for scoliosis or dental issues, but for the leading cause of death in Utah, number 2 in the nation, we're not doing any screening. So I've run a series of bills to put mental health screenings in schools. The schools do it in conjunction with a local mental health provider, and they're not diagnosing or treating, they're just identifying, and then they do a warm handoff with that local mental health provider and the parent if that screen shows that there may be an issue. We've had, even though it's only a few years old, we've had thousands of children referred to treatment, and now about 90% of our schools voluntarily are starting to do these screenings. So those are, in quick summary, 2 of the bills that I'm really most happy about.
It's so great. It's a nice combination of the schools saying, let's help identify and assist kids who aren't seeking help. And then you're also giving the tool to help themselves 24/7. And that tip line in terms of, making it a counselor that answers the phone first, as opposed to a policeman that answers that, is so important. Sue Klebold, you mentioned Columbine, is a huge proponent of suicide prevention because she said her son, who was obviously one of the shooters in the Columbine shooting, was incredibly depressed and saw that he was suicidal beforehand. If he had an app like Safe UT, Steve, he could have reached out.
John, such vital work and such impact. It brings us to our trivia question of the day, our over under. John Draper, I'm going to ask you the question, and Steve's going to do over or under.
Okay.
How many shooting tragedies like a Columbine or an Aurora do we know that Safe UT has averted at this point?
Do we know?
Yeah.
Wow. I'm going to say 100.
100. Steve, is it over or under 100? And how long has Safe UT been up and running at scale, Steve?
It's been in place for about 9 years, but the momentum's been building as school districts, continue to sign on. Yeah. But in this one, I know the answer. It's over that number.
Steve, I don't know the answer. That's the reason that I was going to look to you. The article I found that gave a number was about 4 years old. So do you have an updated estimate, Steve, of how many tragedies have been averted?
Well, in 2 years ago, the number of credible school safety tips that came in was 801.
Yeah.
Wow. I remember that very easily because that's our main area code here is 801.
Yeah.
And, while they may not all have ended up in the horrific tragedies that we've seen, in other states, they were credible threats of somebody bringing a weapon to school or some sort of planned attack. Even my own district, based on tips that came in, they found a student that had fully assembled pipe bombs in their home ready to go. But because somebody saw something and said something, they could do it anonymously, confidentially. We were able to get a lead on it. And per the Secret Service that has a center focused on school safety, they said that the number one thing states can do is an early warning system, because almost all school shooters have some sort of leakage about their horrific plans. And if you can find that out and do something about it, it's the proverbial ounce of prevention.
Yeah.
Wow. And, David, we see so many just heart-wrenching news reports where family members are talking about what happened to their child at school or what their child witnessed or the children witnessing something. And to know that, Steve, you've prevented you can't even, I don't know if we can really count the actual numbers, but we certainly can feel the impact of a safer community in Utah, thanks to the work that you're doing.
Yeah.
Thank you.
The article I saw, Steve, and it may have been a slightly different metric, but it was several years ago, was in the 250-ish range. So I think they were looking at those kinds of scenarios where if this tip hadn't come in, this would have resulted in pretty, again, you never know for sure in hindsight. So Steve, our next little bit is we're going to talk about the challenges of being a state representative. And you tell us, this is a challenge, this is a big challenge, not so much for you, for maybe different in Utah or different with your constituents. So number one challenge, how's this one on a scale of 1 to 5 for you? Balancing constituents' needs. State representatives serve a wide range of constituents with differing views and priorities. Balancing these can be challenging.
It's almost a daily challenge, and you get the whole gamut. I mean, here's one of the biggest challenges. Somebody will, two quick examples. Somebody complains about, street racing in my area, and I'm like, that's a city law enforcement issue. Sorry, I can't help. Constituent contacts me from out of the country. I'm out of the country and my passport's expired and they won't let me home. Can you help me? I'm like, oh, you got to reach out to your U.S. senator for help with the State Department.
Yeah.
So just helping kind of the air traffic control model here, helping people direct them in the right places based on their concerns.
Yeah.
But, for issues that are germane and relevant, just like when a father comes to me and says, do something about youth suicide. One of the greatest struggles is when somebody brings you a problem, then trying to figure out, okay, what do I do about this?
Yeah.
And then once I think I got the solutions and I'm asking the right questions, getting the money, building support amongst my colleagues at the legislature. So it's every day is an adventure.
Building support, Bill really just lays into this next one. Number 2, navigating partisanship, needing to work across party lines can be difficult in a polarized political environment. How's that one for you, Steve?
In the areas that I work in, I found a lot of success.
Mhm.
The singer songwriter Sting has this great song about hope that the Russians love their children too, and he says we share the same biology regardless of ideology.
Right.
There's no monopoly on common sense. And if you look at, who's dying by suicide, it's a bipartisan, demographic.
That's right.
And so it needs a bipartisan, nonpartisan effort to combat that issue. And that's exactly what we've been doing in Utah. And we've also seen glimmers of hope at the national level. The best example is 988 that passed nearly unanimously.
Yeah.
Hey, Steve, have you ever quoted Sting on the floor of the House? That's a great quote.
I think I quoted it once, but I'm hearing you challenge me next session to see how many quotes I can get in. So we'll see
That's
how
pretty good.
Yeah.
Good.
I want you to put a Katy Perry out there, Steve. Let's so, Steve, this bipartisanship, Hatch and Stewart, just some remarkable work over this last 10 years.
Yes. And, Senator Hatch was near the twilight of his illustrious career. And if he were around today, I know I had these conversations before he passed. He did a lot of amazing legislation, the CHIP, childhood insurance program, and amazing things. But he would say that was one of the most important things that he did.
Yeah,
and Chris Stewart, it really wasn't in his lane. But as a military veteran, he also, was aware of the issue that our veterans face, and that was close to his heart. And so even though ideology-wise they were both Republicans, but, kind of from different angles, they locked arms. And so did, basically every other legislator.
Yeah. Steve, and you didn't have this knowledge when you started, but you've dived deep over the course of the 15 years. Complex legislation where healthcare, education, transportation, these can be complex and a lot of technical issues in the knowledge. How's that been for you in terms of challenge?
One of our former late governors, Norm Bader, told me he'd been in the House, then the Speaker, and then became our governor. And he says, Steve, when I first got elected, I thought I knew all the answers. He says, in hindsight, I didn't even know the right questions to ask.
Yeah.
So with enough experience and doing, as a friend said, God gave us 2 ears and 1 mouth in that order for a reason, trying to use those ears and do a lot more listening than talking. I've learned a lot from, experts, including both of you. And so listening, learning, and then trying to build stakeholder support is key to trying to, get something done.
Yeah. Let's do 2 more. Work-life balance. In many states, being a legislator is technically a part-time job, but the demands often exceed part-time hours, and you've got a full-time role, Steve.
Yeah, it's difficult. Now, I'll brag a little bit about Utah here, okay? We have basically the shortest legislative session in the nation. It begins next week. It's technically 33 working days and 45 calendar days. And then for the past decade plus, Forbes magazine has ranked Utah the best managed state in the nation. So best managed state, shortest session, less is more, less monkeying around equals better results. The key issues bubble to the top, and that's what gets passed. And if it doesn't, we revisit it next year. It's difficult. I've got a day job. I work in healthcare by day and moonlight in the legislature at night. But it's a citizen legislature. We have to go back and live with the laws that we pass. And I don't know anybody in the Utah legislature that does this for a career. You'd be living in poverty if you did.
Yeah.
But I like our system. Wouldn't trade it for anybody else's.
And just to contrast that quickly with Texas, Steve, I think Texas only has a legislative session once every 2 years, right?
Yes, but it's a lot longer.
Okay.
Steve, last one, public scrutiny. Constant, we have social media challenges, constituents, the media, advocacy groups.
It's a constant challenge. I have a pass that I pay for to drive in our carpool lane, and a constituent took a picture of me getting off in the carpool lane exit and said, how disappointing that you'd violate the law. And I said, thanks so much for being vigilant. The rule of law, nobody's above it. Here's my receipt for my fast lane class. Have a nice day. So, I wish every, question or criticism, I had a quick response like that, but it's part of the job. It's what we sign up for, and we should be held to a higher standard.
Yeah. So, John, I'm going to pull an audible here on our last segment of questions and flip flop something here. So, following those up, Steve, these challenges, you've been tackling them, having impacts all across the board. Why not run for national office?
Well, because I want to get things done.
That is what I thought you'd say. Yeah.
Look, states are the laboratories of democracy.
Right.
And if you look at the number, there was a point a year or two ago where I individually, I think, had passed more bills than the U.S. Congress. And again, we have a 33-day session.
Yeah.
But when we have the gridlock that we've seen so many years ago and the narrow majorities and divided houses, it's extremely difficult to even name a post office after, a local hero or something if you're in D.C. Here, we get together, we have to figure it out. We know we got to get back to our day jobs there in, a month or two, and we get things done. And so I don't feel like I'd be able to do as much. And, if you ask my wife, she'd say I can do that with my next wife. And I don't have any plans to run for higher office.
Well, welcome to the Beehive. That's the way they do it there, Steve. They get it done together. And, a perfect example of that to me is, your work with the gun lobby. I mean, can you imagine at the national level achieving the kinds of things that you've done with the gun lobby to help enhance suicide prevention in Utah? Could you talk a little bit about that and how you've achieved that goal? Because it would be great for you to give some advice to the people at the national level about this.
Yeah, we could have a whole podcast on this, John. But real quickly, our biggest gun lobbyist in Utah was actually one of my constituents. I said, can we get there for lunch? And I said, I need your help in the world of suicide prevention. He laughed at me. There's actually a documentary done about our relationship and our work called Wake Up, Suicide Prevention Stories from Across America. And after I explained the statistics to him, he became very sober. Fast forward a number of years, he ended up speaking at the American Association of Suicidology's national meeting about the work that we've been doing together. Yeah. And just to sum it up, Kathy Barber at Harvard University, Chancellor of Public Health, gave me this great analogy, two circles that kind of interlock. One is the anti-gun lobby, the other is the pro-gun lobby. And she says, if you want to make a lot of noise, you can dwell in just one of those circles. If you want to get something done, you dwell in the little area, the little oval of overlap, which is the culture of safety. And that's allowed us to pass numerous bills on firearm safety. And I've actually, one of our bills was introduced in Congress, but it didn't pass. But we're going to keep trying.
Please.
And speaking of areas where we could spend a whole hour on that topic alone, Steve, the crisis receiving facility that you at the University of Utah are building out with the Huntsman Family Foundation. Tell us about the vision and the status.
Yes, thank you. So our three-leg stool of someone to call, someone to respond, and a safe place to go. This is one of our safe places to go. So I ran a bill back in 2020 that helped build out our MCOT, mobile crisis teams, statewide, as well as our receiving centers for Salt Lake County, with very generous assistance from the Huntsman family and the Huntsman Mental Health Institute. Here in about 2 months, the Campus of Hope will be opening, the Huntsman Mental Health Institute Campus of Hope. It will have about 32 crisis receiving chairs, 24 inpatient beds for those individuals that can't be stabilized in that 24-hour period, and then a host of outpatient case management, dental, legal, substance use disorder, wraparound services that will be made available to people going through the crisis care center, because we're not going to be giving frequent flyer points, and we want to equip them with all the tools they need, then they never have to come back. If they need to, we're here for them. But we think this is going to be the most beautiful and hopefully the greatest, most state-of-the-art facility in the nation. I've toured numerous facilities around the country. We've tried to take best practices and learn from all of you. Many years of the Crisis Jam. And so we're really excited about the grand opening here in just a matter of weeks of the Campus of Hope.
Well, Steve, we'd love to join if that invite could be extended. I did get to tour the the steel infrastructure. We've had Kevin Curtis on the podcast. Really spectacular work. It's going to set an example and set a new standard that communities are going to emulate as we move forward. So thank you so much for being with us and for your amazing leadership. It's the passion and the expertise, and we can do this better. We can do this different. It's exciting, John Draper. It's for us to see these things coming to life. They're coming to life because of the passion and political activation, Steve, of leaders like yourself. So, John Draper, that brings us to the segment we know as the plain truth, and we want you to give us some.
Well, I'm happy to do that. And just to say, Steve, you are a good man doing great work. Meanwhile, I'm wondering if we're always going to be seeing a steady stream of news reports of school shootings and young people instigating violence with nothing being done. I mean, every one of these tragedies, we're just going to continue to hear the loud drum beats for gun safety and addressing mental illness, and we don't see any progress in either area. Now, there's obviously some exceptions like the one in Utah, but firearms are the leading cause of death for young people, now higher than motor vehicle accidents, and 30% of these firearm deaths are suicides. Now there's maybe a steep hill to climb for gun legislation, but there's much more we can do to protect and improve the mental health of our young people in schools. Of course, our guest today, Representative Steve Eliason, as I was saying, is one of those people that walks the walk. He's able to provide a way to help the kids in schools with mental health programming, and also doing something to enhance the safety of them and prevent these kinds of shootings from happening with Safe UT. But how could it be if we could educate all our children about mental health in their schools, give them information, tools, and skills to navigate that roller coaster that is their brains and emotions? I did not like my health and physical education classes in school, but they were mandated in every public school in the country, and I did perhaps learn a few things. And I was pretty happy about our school nurse, as most public schools have them, but somehow it seems to be acceptable to leave out mental health and addressing our health education priorities in schools. The one thing that literally everyone from the World Health Organization, the United States Department of Health and Human Services says is foundational to overall well-being. It's irresponsible, really, and even dangerous. Nearly 50% of adolescents, that's almost half of every group of 13 to 18-year-olds, they struggle with mental health disorders at some point in their lives. About 1 in 5 adolescents are going to struggle with suicidal thoughts, anxiety, and depression each year. If school wants us to get ready to be successful for the real world, they can start by just teaching us how to survive through school. Basically, schools should help young people build higher emotional intelligence in addition to academic intelligence, higher EQ, how to identify, tolerate, and manage challenging feelings, which has been consistently associated with higher academic and professional performance, stronger relationships, and higher resilience in confronting life's inevitable setbacks. And man, I would have loved learning about how to manage my stress with academics and relationships better, how to resolve conflicts with my friends or my girlfriends and my family rather than avoiding them or aggravating my beefs with them, or just how to effectively communicate what I needed from them. How cool would it have been to know the signs of depression or anxiety or trauma and suicidal ideation, like we might know the signs of a heart attack? And it would be great to know what resilience actually looks like and how to build it rather than just hearing about it in the abstract. Teaching and learning this stuff is just great for school culture in general, and suddenly classmates become allies rather than bystanders, and teachers become the first line of defense, noticing changes in behaviors that might otherwise go unaddressed. Now, the majority of states do not address mental health in their public school curricula, and about 9 currently mandate some form of mental health education in the schools at varying grade levels. Now, the ones that have been doing it for a while are seeing some positive outcomes. So New York State, for example, they were the first. They passed a law back in 2018 requiring all schools to include mental health in the curriculum. And since then, some districts report better attendance, fewer disciplinary incidents, and most importantly, fewer crisis-level mental health emergencies. Another example is Virginia, where they've mandated mental health instruction for 9th and 10th graders. Early data shows that that students are more willing to be open about their struggles and seek help when they need it. Now, however, more work is going to have to be going into finding the right curricula for that's most effective for schools. But we can do, once we mandate that, we can say, all right, now that we're going to be forced to do it, let's find the best curriculum. But right now we are not doing that. Now, if we add more things that we know work, like suicide prevention programs in schools, bullying intervention, peer support programs like Active Minds, screening like Steve Elison's talking about, trauma-informed staff training and the creation of wellness centers, all of that is really, really important. And all of that translates into fewer violent incidents, fewer crises, and better academic outcomes. And you want a stronger nation, a stronger workforce. It starts with a generation of kids who actually know how to handle life's whirlwind of emotions. So the bottom line is that mental health education is an absolute must. It's not a nice to have, it's a need to have. If we keep shortchanging the mental well-being of our children, we're basically guaranteeing more shootings, more suicides, and more commonly, derailed potential for living better lives. So let's stop pretending this is not important, or even pretend that we can just leave it to the parents to teach their kids. We need more counselors, more peer support chapters like Active Minds, more suicide prevention training for teachers and students, and above all, a full-fledged mental health curriculum that meets every child right where they are, kindergarten through 12th grade, because the stakes couldn't be higher, and the time to act is right now. And David and Steve, that's as plain as my truth is going to get today.
John, thank you so much. And Steve, thanks for the amazing work that you've done with our youth and laying a groundwork not only in Utah, but around the country. A huge thank to our guests today. Be sure to join us next week when we'll be with Dr. Chuck Browning, has been the medical director at Recovery Innovations for years, and recently took on the helm as CEO and president of Behavioral Health Link, and is a national innovator in this important work. So thanks for letting us draw you in this week. Season 2 is going to be fire, and I'm looking forward to it with my partner Brooklyn here. Come back next time as we continue to navigate the currents of crisis and care and think about systems. Until then, remember, every call, every life, every story matters. Stay connected, stay supportive, and we'll see you on the next episode of Lifelines.